I am Chaik Dalbeni. I'm the Harrison McCrae Dixon MD and Clifford C. Baker Presidential Professor and Associate Professor of Biostatistics and Epidemiology at the University of Pennsylvania. I'm really delighted to talk with you about this study. Colon cancer screening is really important and can prevent cancers, but there are multiple steps involved. And to date, we haven't actually taken a really deep look at each of the steps involved and how failures in each of those steps could increase or affect the risk of dying from colorectal cancer, even the benefits of screening for colorectal cancer. So what we did in this study was try to fill that gap in the literature or our understanding of the colorectal cancer screening process. And in this study, we basically went into patient records and clearly outlined each of these steps involved, i.e. whether people initiated screening, whether they continued to screen, and whether or not they followed up with abnormal screening tests when they were positive or abnormal. And this study was done to basically answer those questions. So our objective in this study was to, one, characterize each of those steps in the screening process that could lead to failures, and by extension also lead to death from colorectal cancer. We needed to understand as well to what extent each of these steps occur in people who either die from colorectal cancer or in the general population. And the third objective was to basically then ask the question, which is, to what extent do these steps, each of these steps, contribute to death from colorectal cancer? Not directly, but to basically understand the risk associated with failures of screening. So this is a study that we conducted in Kaiser Permanente in both Northern and Southern California. And these are large integrated delivery systems that have large amounts of data, rich data as we call it, that allows us to track people over long periods of time. So in this population, we basically had close to about 2 million people who were eligible for screening. And out of these, we identified about 1,700 for these purposes who had died from colorectal cancer when they were about 55 to 90 years of age. Now, after we identified these people who had died from colorectal cancer, we needed to also know and follow people who basically did not have colorectal cancer but had similar histories as those who had died from colorectal cancer. So we identified about 3,500 of those people. So after we carefully looked at the history of these people over a 10-year period, what we found is that among those people who had died from colorectal cancer, a whole 76% of people were not up to date on screening at the time that they were diagnosed with colorectal cancer. Now that means that about 24% of people were up to date and died despite being up to date. And that can happen because the tests are not perfect. But if you look at those people who were not diagnosed with colorectal cancer, the difference was that 46% were up to date at the time, the same dates when the others were diagnosed with colorectal cancer. So if you compare the two people, as we did in this analysis, what we discovered was that being up to date on screening reduced the risk of dying from colorectal cancer by about 62%, which is a really large number. Now, if you flip it around, what that actually means is that if you are not up to date on screening, your risk of dying from colorectal cancer is about 2.6-fold higher than if you were up to date. And so if you go down, as we did in the screening process, to look at each of these steps involved in screening, what we then also found is this. If you did not initiate screening, your risk of dying was 2.5 or so fold higher. If you didn't follow through with continued screening, and that means you are not following the guideline recommended intervals, it was similarly high. Now, what we found was really surprising, but somewhat expected, really, was that if you did not follow through on abnormal tests, this is to say your test was abnormal, and you should have had, for instance, a colonoscopy, but didn't have that colonoscopy, the risk of dying from colorectal cancer was about sevenfold higher than if you were up to date. So it really underscores the fact that it is important to not only start screening, but also follow through with, continue to stay up to date and have this diagnostic test done when it's abnormal. Well, so putting all of this together, what we showed in this study was that, people need to initiate screening when they are due, screen regularly at the appropriate intervals that are recommended by guidelines. And really importantly, when the test is abnormal, it's really important to follow through with the diagnostic testing that's recommended, because if that does not happen, the risk of dying from colon cancer is much higher. And the reason is simple. If your test is abnormal, it indicates that your risk of having cancer is real. You could actually have cancer. But what's the purpose of doing a test if you don't follow through on the diagnostic testing, which is really important to do? So not only have we shown in this study that it's important to get people screened initially, it's also showing for the first time, we believe, that the steps, following all the steps and completing them is really crucial to realizing the benefits of screening.